Hi, I'm Dr. Simon Ravichandran. I'm an aesthetic doctor in Glasgow and I work for the Clinetics Rejuvenation chain. I'm going to talk about the role of LED phototherapy in the aesthetic clinic. We'll talk briefly about LEDs and LED devices. We'll talk about how phototherapy works, talk about the indications for phototherapy, and I'll talk about the device that I've got and how I use it in the clinic, and then we'll show a little bit of some outcomes. So LEDs are semiconductor diodes. They are cool, they're non-thermal, they don't emit any heat energy at all. They're narrowband, which means that they'll emit a range of very narrow frequencies, which allows them to be specifically focused into different colour groups. And the energies that they produce are very, very small. The fact that they're narrowband means that you can have a variety of different wavelengths at the same time, and you can have a whole array of different coloured LEDs in the same device. Now, when we're thinking about LED phototherapy, we're talking about light therapy, so we think immediately about IPL and about laser. But IPL and laser are a little bit different, so we'll just cover the differences here. Laser and IPL work on the principle of selective or non-selective in terms of ablative phototherapy, but they work on the principle of photothermolysis. Now, with LEDs, there is no heat energy to be absorbed, there is no photothermolysis. The principle of effect is a process called photobiomodulation, for which you require a photon to be absorbed by a target chromophore to be energized to produce a desired result. Because they are not thermal, there is no chance that LED phototherapy can burn or damage skin tissue, and there's accordingly no risk of pain, no risk of scarring, no risk of pigmentary changes, and no risk of infection. Another great advantage of using an LED array is that you can combine wavelengths to target multiple indications at multiple depths within the tissue at the same time. So you can treat multiple conditions, but you can also treat one condition synergistically with a different series of approaches. Photobiomodulation is the principle, and the law of photobiology is that for any biological effect, the photon must be absorbed by electron absorption bands belonging to a molecular chromophore or a photoacceptor. So it's similar to your lasers and your IPLs in that there's a specific chromophore that absorbs the energy, but rather than absorbing the energy in forms of heat, the photon is absorbed by the electron shell of a particular chromophore, which energizes that atom to put it into a different excitation state so it behaves slightly differently. We'll talk about exactly how that works in a couple more slides. Next principle of all light interactions with tissue is that you can have a variety of different processes when your light bounces off your skin or goes through your skin, so you can have some reflection, some light gets transmitted and scattered, and the process by which the actual photobiomodulation works is absorption. So it's going to go through the skin, some will get transmitted through to specific depths, a very small amount will get transmitted all the way through, it will scatter, it will bounce off structures, and it will be absorbed by selected chromophores dependent specifically on the wavelength of that light. The depth of penetration is exactly the same with light, with lasers and IPL. The depth of penetration with LED light increases linearly within the visible spectrum. So your low wavelength light, 420 nanometers, going up to high wavelengths of 755 nanometers in the red range, will show an increased depth of penetration throughout tissue, which means that if you have a combination device that has energy levels in the blue spectrum, 420, as well as energy levels in the high end of the spectrum, it means you can cover two different depths at the same time and treat two different conditions, or treat one condition in two separate ways. The device I use, as I mentioned in the introduction, is the Dermalux Tri-Wave LED device. This device has three different sorts of LED that emit light at 415 nanometers in the blue range, 633 nanometers in the red range, and 830 nanometers in the near infrared range. So we've got to think about where the actual effect is taking place. And as far as we can postulate at this point, the main mode of effect is taking place in the inner membrane of a mitochondria. So if you remember, your mitochondria has got an outer membrane and an inner membrane with the matrix inside. The inner membrane of that mitochondria is where the biochemical process of the Krebs cycle or the electron transfer chain takes place. And this is the place where energy is produced. Energy is created by the production of adenosine triphosphate from adenosine diphosphate, ADP to ATP. So let's put our chromophore in the inner membrane of your mitochondria, and then this chromophore will get hit by light. So let's look a little bit more closely at that particular process. Your chromophore tends to sit in here. This is stage 4 in the electron transfer chain, and that particular protein is cytochrome C oxidase. Now, cytochrome C oxidase is the rate-limiting step in the production of ATP via ATP synthase. It's the rate-limiting step because your mitochondria itself produces nitric oxide, and it produces nitric oxide as a deliberate evolutionary ploy to help reduce the overuse of oxygen and divert energy resources within the cell. But it's the rate-limiting step, so that cytochrome C oxidase can be blocked by a nitric oxide molecule or indeed a carbon monoxide molecule. So shining your 830 nanometer or whatever nanometer wavelength light directly into this area will have absorption by a chromophore, which will then unblock or will displace the nitric oxide or the carbon monoxide and allow the electron transfer chain to continue unimpeded, which will result in the presentation of your electrons, your H2O, to your ATP synthase to allow a production of adenosine triphosphate, ATP, and a bunch of other subsequent processes that are involved with that, which will result in upregulation of various growth factors and transcription factors. So let's go back. We'll consider the 830 nanometer light. This is probably one of the most studied wavelengths of light. Your chromophore on the electron transfer chain gets hit, it gets unblocked, your ADP to ATP process increases, and the net result of that in the macrophages of the fibroblasts of your dermis is an increased production of cytokines and growth factors, which results in fibroblast proliferation and also a direct increased production of tropocollagen from your fibroblasts. So you get a regenerative outcome with improved wound healing, repair, and inflammation. So that's 830 nanometer light. But we also know that we use phototherapy very effectively in the management of acne. So let's consider the causative organism in the majority of acne, Propionibacterium acnes. Now this bacteria produces in its cell porphyrins. Two porphyrins principally are of interest to us, copper porphyrin 3 and protoporphyrin 9. Both of these porphyrins are sensitive to different wavelengths of light. And when they get exposed to those wavelengths of light, 415 nanometers affecting copper porphyrin 3 and 633 nanometers affecting protoporphyrin 9, we get a resultant production of singlet oxygen, which results in lysis and cell death. Now, if you remember, your blue light penetrates very superficially in the skin, your red light penetrates a little bit deeper. Both of these lights will result in cell death of Propionibacterium acnes, which means that you can combine these two wavelengths of light for an effective and efficient and safe bactericidal effect in multiple layers. Consider 415 nanometers of light. We know now that it's bactericidal by interacting with copper porphyrin 3 to break it down to produce singlet oxygen and cell destruction, but it also has an anti-inflammatory effect by reducing the production of interleukin-1 alpha and ICAM-1. So it's a multiple modal effect. Then consider 633. On the right-hand side, well, we know that it's bactericidal. We know it affects protoporphyrin. We get production of singlet oxygen and cell destruction. It's also anti-inflammatory. It has an effect by downregulating the production of phospholipase A2, cyclooxygenase, and prostaglandin E2. In addition, it also has wound healing, repair, and anti-inflammatory response by the effect it has on macrophages to increase the production of cytokines, growth factors, fibroblast proliferation, fibroblast activities. So 633 nanometer wavelength light actually has three main actions to consider: regeneration, bactericidal, anti-inflammatory. And then consider finally the melanogenesis pathway. The melanogenesis pathway starts with tyrosine, and an enzyme tyrosinase starts that tyrosine on the pathway where it gets converted to dopa, then dopaquinone, then leukodopachrome, and it goes through the processes which result in pheomelanins and new melanins. If you have a pigmentary disorder, one of the first things we want to try and stop is reduce the activity right at the top of that of tyrosinase. You want to reduce the conversion of tyrosine to dopa to dopaquinone, and then you can get a resultant reduction in the production of pheomelanins and new melanins. Your 830 nanometer light is known to be a direct inhibitor of tyrosinase activity, which means your 830 nanometer light is an inhibitor of melanogenesis and is therefore a useful adjunct in the management of pigmentary disorders. So we have 3 wavelengths of light, 3 different depths of penetration, multiple modes of action, all of which can be used synergistically to treat skin conditions as well as anti-aging concerns. So based on what we understand of the process, and based on what we see from the clinical effects over years and years of practice and thousands of treatments, we know that LED phototherapy is useful in the management of anti-aging. So it will address fine lines, complexion and texture. It will help address acne and spot-prone skin. It will help affect rosacea. It will reduce erythema, reduce flushing. It can be used in the management of hyperpigmentation. It can address dehydrated and dull complexion in the skin, and it can affect inflammatory conditions. It is incredibly useful in the management of healing and pain relief following invasive treatments. So it's very useful in the management after laser treatments, after IPL treatments, after chemical peel treatments, and after microneedling treatments. And it also seems to have an effect on relaxation and well-being. So what do we do with it in my clinic? Well, I start off the week with an I Love Mondays program, and I finish off the week with an I Love Fridays program. Doesn't matter what we call these, but these are programs specifically designed with the Dermalux LED phototherapy device. So they're multimodal treatment packages which affect a skin concern in multiple different techniques. So we'll use a chemical peel, a microdermabrasion, microneedling, whatever it is. We combine it with a Dermalux, and we have an effective and safe skin rejuvenation treatment that we can do for patients on a Monday and on a Friday. But you can do it whatever day you want. Then we combine our Dermalux LED phototherapy with all our regular offers, and then we have our patients coming out in throughout the week that have a variety of treatments: microdermabrasion, microneedling, and PRP. All of these will be offered a Dermalux treatment or a phototherapy treatment in order to enhance recovery and improve outcomes. And of course, we also offer it as a standalone treatment. Let's have a look at a few outcomes. These outcomes come from Dr. Pablo Naranjo. This is a patient he treated with pulse dye laser. It's a purpuric laser for rosacea. So you get some erythema immediately after the treatment. And this is a before and after an LED phototherapy session to settle down that erythema. This is immediately afterwards. So you can see with the hemoglobin scan here, immediate reduction in the hemoglobin in the skin. And this is the anti-inflammatory response. And this is the same one. This is 72 hours post-alexandrite laser. This is an outcome for a little bit of pustular comedonal acne, showing that it's useful in the management of acne. It's useful in the management of acne here. Acne rosacea, general anti-aging skin concerns, improved pigmentation, improved tone, improved luster, reduction in papules. It also can be used in the management of atopic dermatitis and psoriasis. So to summarize, the Dermalux LED phototherapy, and all LED phototherapy in essence to me, is an incredibly useful adjunct to pretty much every treatment protocol or every procedure that we can do in an aesthetic medical clinic. It will enhance outcomes, it will speed recovery, and it's also useful as a standalone treatment or in terms or as a treatment that you could incorporate into a home topical regime. So we use it with skin rejuvenation, retinol-based, hydroquinone-based creams, whatever the concern is. The client comes in for regular phototherapy sessions, we see a faster and better outcome. And that's it. Thank you very much.